Aloha, happy Wednesday. Thank you for joining us. I'm Yunji Denise, joined by Ryan Kalei-Suji. This, of course, is Spotlight Hawaii. Welcome to all of you who are here. Please start typing your comments and your questions, rather, in the comments. And Ryan, today we have a man who is usually one of our most popular guests.
That's right. Joining us this morning is Lieutenant Governor Josh Green. Good morning, Lieutenant Governor. Thanks so much for joining us this morning.
Good morning.
Let's start off. Yesterday was a big day, of course, for the state. New those travel restrictions that we saw have been lifted for neighbor island travel, as well as those who have gotten vaccinated in Hawaii can now travel into the state through that vaccination verification process. What have you heard overall from this first day of these changes to the travel plans here in Hawaii?
I've only heard good things. Thank you for welcoming me, by the way, again. This is something that people are saying, hey, it's about time. That's what the people are saying, and I'm appreciative of the changes that the governor approved. It just makes it a lot more easy for us to travel back into the state that we love, after we've been visiting our family and friends. Also, traveling inter-island is no threat whatsoever. People are, vaccinated. About 2/3 of our whole state has immunity now. And so it's a good time for us to be opening up and beginning to return to normal. But this was a game changer, and then we will extend this game-changing event to, I guess, the rest of the continental United States when we touch 60%, which will happen in 8 to 10 days.
Okay, let's talk about that time frame, 8 to 10 days. That does sound pretty fast. What are we doing, or what is the state doing to reach the populations who have not been vaccinated? And are we keeping pace with the expectations that were set out by the governor?
Well, we're enticing them with chili from Zippy's and tens of thousands of miles, and reaching out to individuals that had health disparities. A lot of our population who's less affluent, who has had economic disparities, didn't have a chance in their backyard to get vaccinated in their neighborhood. So we're extending lots of extra places, up to 300, but we're doing everything we can come up with. Like I said, incentives to opening up more sites to get vaccinated. At this point, there's not anyone in the state that isn't aware that they can get a free vaccination. So it really comes down to people just making that personal decision to be a part of this return to normal. The Gov set up 60 and 70% as our landmark goals. We're really close. We're over 61% now of people who have at least initiated. So that means we'll get to that soon. That's why I said just 8 to 10 days. And we're at 55+% of those who have actually completed their vaccination. So we're just like 50,000 shots away. That's just shots from getting to that 60%. So that's going to happen, but then it's going to be a slog to get to 70%.
Well, let's talk about that next threshold after that 60%, that 70%. What is that time frame looking like right now, and how realistic do you think it is for the state to reach that threshold, and thus allowing all of the COVID, protocol, if you will, to kind of be thrown out the window and basically everything returns back to normal?
Well, it's realistic. Keep in mind, we're third best in the country, behind Massachusetts, Vermont, and then us, to get vaccinated for our adult population. So, those numbers are very favorable for us, but getting to 70% is a challenge. The reason it's a challenge is because in the denominator for our population to be vaccinated and get to 70%, we have to include, per the governor's advice and decision, our keiki under age 12, because it's a disease that can affect everybody. But we have 216,000 kids. I got one kid on the other side of 12, Maya, and she's fully vaccinated. But then I have a 10-year-old who, of course, can't get vaccinated, Sam. So families all across the state are in this bind, and those 216,000 individuals can't get vaccinated yet, which means we'll have to push hard. If you look at our current trajectories, we're doing about 6,000 shots a day. Should be about 160 to 170,000 shots a month. We'll get there, especially if people choose the Johnson & Johnson single shot protocol. But it's going to take 6, 7, 8 weeks at least to do that 10% of people from 60 to 70%. And man, I'm really hopeful that we get there. I will propose to the governor, if we stall, a couple other ways to demonstrate that we're safe enough based on hospitalizations, case counts, and the people that have actually had COVID before. But let's not do that. First, let's go to 70% if we can get there, because it's in our interest from a public health standpoint.
You know, it's interesting you mentioned Vermont, and I was looking yesterday. Vermont obviously is doing very well, and I was reading in the paper that they had 80% of their folks vaccinated. But then at a closer look, it's that denominator difference that you mentioned. When they talk about their percentages, in California and New York, as far as I can understand, are in the same boat. They only count those who are eligible for vaccinations. And so it's easier to get to those thresholds. Do you think the governor is being too conservative in including those children in that count? Because it's going to be incredibly difficult to get there, as you mentioned, when you have that large population that just can't get vaccinated.
Well, yes, because I'm a troublemaking emergency medicine lieutenant governor, and he's a more cautious conservative engineer governor. But the benefit is that we have not been killing people with COVID like a lot of other states. And so our caution has been good. I will say this, if we have very few people in the hospital, we're down to 32 people in the hospital total statewide, and our case counts are in the low double digits, there will be a compelling argument to be made, and I'll make it, to lift all restrictions, even if we haven't quite touched 70%, because we have set a much higher standard. At the end of the day, we've had 80% fewer deaths than we would have expected based on our population, which is something to really celebrate. And as you can see, people are flocking to Hawaii, not just because they missed Hawaii, but also because we're the safest state in the country. So these are very complicated questions, and the gov is pretty conservative. I think we're safe, but let's get to 70% if we can.
We got a question here from Todd, who's asking, is the technology in place for the vaccine verification from other states when we reach 60%? We know that initially this was an issue of just getting this on board to verify those who have gotten the vaccination in other states and being able to really verify that on the state's end. What has been developed during that time to allow this sort of verification to now happen for those who are vaccinated in other states?
Well, great question. As predicted, companies all across the globe are racing to have essentially a digital vaccination card or a digital vaccination app. So states, in New York, California, there's people out there right now that are making it easy for travelers to show United, show Hawaiian that they've been vaccinated. So we have a lot more capacity than one would have thought. Also, we're just not seeing people be dumb enough to falsify a federal document just so they can come and be on the beach with you two guys. So I think that it's important to realize it's not the main sticking point. The main sticking point was being able to see a clean card to make sure that we could run checks if we had suspicion. I don't think there's going to be significant fraud. And as you know, we've had almost no travel-related cases of consequence. So with our positivity rate down at 1% exactly, our case counts dropping, these aren't my worries. Now my worries are, how do we get people psychologically back to normal? Are we ready for school to open up? Are we going to actually have too many travelers? That's actually started to rear its head again. So we have the tech that can adequately run this program. And I just got a text from Doug Murdoch as we were speaking. We had over 2,000 individuals just yesterday use the vaccination cards to travel from the mainland, 2,000 of our people. So it's going to be extremely fluid. Also, it's going to make the lines shorter. Apparently, it's an easier tech to use than checking for people's tests.
Yunji's mic is.
Oh, sorry about that. There's a couple of questions here expressing some frustration, and this is going back to that whole denominator question. I just want to include this because I think it expresses what a lot of people are concerned about. Stan says, who made it a smart idea to make the denominator include those who cannot get the vaccination? It makes no sense whatsoever. And then say, oh, let's get to 70% vaccinated. That actually means more than 80% have to be vaccinated, not 70. Tell the truth. Well, I don't think you're not telling the truth on this, but how do you respond to Stan and others who may feel that these goals are just too aspirational and impossible to reach?
Well, I like Stan. I would correct his number. It's actually not 80%, it's 82%. But got to get 82%, Stan, of the people with that denominator in there. Whose idea was it? It's the health guys, because they explained to me very clearly that when you have this many people in our country that are getting COVID, including like the Delta variant, which is affecting kids, you got to consider how that would spread. Now, having said that, I do understand what people are saying. I will make the case, if we're close, that we should certainly count the 4% of people in our state that have had COVID. It's about right. And then also if we're seeing, only 15, 20 people in the hospital with COVID, there's no reason at all to hesitate. At that point, the numbers are so low, down from our peak of 318 back on August 26th last year. We have to open up. So I'll make these cases, so don't worry, Stan. It'll be all right.
Oh, I want to ask about the Delta variant that you just mentioned. We know that we had a confirmed case here in Hawaii. How concerned are you and Department of Health officials about this? And is there anything being done to further track how that spreads here in Hawaii?
There is. We've now had 2 cases, it turns out. So a second case has been verified. The Delta case, the Delta strain, is a new strain, as you know, from India. It found its way to Europe, England in particular, and then over here. One of the reasons that it's hitting Europe and it overwhelmed them is because they went to that protocol of just having one shot, to get one shot into all their people, but not 2 necessarily. That only offered about 60% immunity, not the 95% immunity we've seen with the 2-shot protocol. So they got this variant well entrenched there. We will see the Delta variant increase. It went from 6% to 10% very quickly in the mainland United States. We'll see more Delta variant, but only if you haven't been vaccinated. If you've been vaccinated, you're safe from the Delta variant for the most part. There will be a couple breakthrough cases, but most people, there's probably a lot of Delta variant that people have been exposed to, and it's been blocked by their vaccinations. One thing I would comment about this Delta variant is it is showing a higher rate of hospitalizations. So people are ending up in the hospital. I just read a paper this morning at about twice the rate. So it's probably a little bit more severe. So everyone, please get vaccinated. It's such a boring message. I apologize for being a boring guy on this, but tell your friends, tell your loved ones to get vaccinated so that we can end all of this, whether it's 70% or close to 70%. But then we won't have to worry about this Delta variant. One last thing, our hospitalization rate has been dropping. It's down 20% over the last 2 weeks. So we don't have some kind of background surge of Delta that we're not seeing, because we are doing a full genetic assessment of 300 cases a month minimum. So we're checking for it.
I know you mentioned that you have a 10-year-old who can't get the vaccine yet. As you know, I've got 2 little kids as well. How soon do you think it'll be when our kids and those their same ages can actually get vaccinated?
I think that's his phone going off in the background right now. In fact, he probably heard his name called, and that's why. I think it's September, October, probably closer to September, though. They are in the process of getting approval for ages 5 to 11, and actually 6 months all the way to 11. They're using smaller doses, of course. It's an mRNA vaccination, so it triggers the immune response. And I think it's going to be ready for school time, or at least where most schools start. On the mainland, it's nearer to Labor Day. We get there a little earlier. But I'm eager to vaccinate that guy because he's making faces at me in the background right now. And he'll be one more immune person in our state to count towards that denominator.
One of the, of course, questions as we head into July and we're into the middle of this year is how long this vaccine is good for, and when will the booster shot be needed? We know that studies continue to be happening right now as we speak about that. Has there been any indication about a potential follow-up shot, a second or third in this case shot, or any booster shots that may be coming sometime this year or maybe into next year?
Yes, it looks like 9 to 12 months for a booster shot after completing one's vaccination cycle, whether it's one shot from the Johnson & Johnson or the 2 shots from the Pfizer or Moderna. We're still waiting on this data because we have to actually see the amount of time pass and whether people's antibodies are intact or not after having had the vaccinations. I wouldn't worry. We shouldn't rush to the conclusion that we're vulnerable, because we are seeing the cases plummet across the country. What had been as high as 250,000 cases a day at its peak is now down to 12,700 a day on the mainland. And of course, our peaks that had been near 300 are down to, I think it's 30 cases today, down 90%. So things are working. That initial surge of immunity to coronavirus was most important, because remember, going back to the very beginnings of this, we called it a novel coronavirus, which is really meant that something our systems had never seen before. And when it's that novel, we have no immunity. Now we have incredible amount of immunity. I mentioned we have about 2/3 of our people immune right now in the state. Well, that's because we're at 61% of all individuals have at least had one shot, 55% have had both shots, and another 4% have had COVID. At least. That's probably an understatement because we don't test everybody. So with about 2/3 of our people with some immunity, there's nowhere for the virus to go, or not as much, except in some cases, clusters happen at prisons where very few people got vaccinated, or in rural communities where we've had vaccine hesitancy.
On the subject of prisons, Terry wants to know, what about the prisons? Hilo is past 100 cases already. We had talked about this before. It's not only the prisoners, it's also the people who are guarding and working in the prisons. What is being done? What are those conversations like right now in terms of mandating some kind of a vaccine? I know you had talked about the last time you were on here, perhaps trying to have some kind of a requirement for at least the front-facing folks, or cycling them into other jobs. Can you tell us about any evolution on that topic?
Yes. So 124 individuals at HCCC did catch COVID. It's not surprising because our vaccination rate amongst our incarcerated individuals, the prisoners, was like at 25% or so. And that just means they're going to catch COVID. And as I said before, these are not your typical rule followers, so they're not getting vaccinated when authority figures tell them to. I would say to them and their families, please do, because as your doctor in this case, I just don't want to see you catch COVID, because it's very difficult to have adequate social distancing. It's challenging. We have encouraged all of them to be vaccinated. We go back multiple times. Also, our guards, I am still adamant that the right thing morally to do is to, if you're a healthcare provider or a prison guard working in front of people that have no choice but to see you because they need you as the professional, or they're locked down and you're the one there, you need to be vaccinated, because otherwise you'll catch COVID in the community and you'll spread it to them, or they will catch COVID and spread it to you, and you'll go back to your spouse or your significant other, and then it will be in the community again. So I still feel very strongly about that. That's a discussion that the Director of Public Safety, who I have a lot of respect for, Mr. Otani, has to have with the union leadership, and I've encouraged them all to come to that conclusion, because otherwise, even though we don't have enough personnel to just do a lot of overtime for the vaccinated individuals, what will happen is people are going to catch COVID and then be out for 10 days or longer if they're very sick, and it will have the same effect. We won't have enough professionals. So please get vaccinated.
We know that there have been some modifications, of course, to the tier system, and tier 4 now looks a lot different than what was outlined last year here for the city and county of Honolulu. One of those accommodations has incorporated the use of testing or a vaccination verification process to enter certain types of events or venues. How long do you foresee that type of verification process happening? Do you think that this is something that will continue on into the fall, maybe even into the winter? How long do people do we expect for that sort of verification process to continue on?
I think until we touch 70% vaccinated or immune status, I will start promoting more strongly 70% immune status, meaning those who have completed their vaccination cycles plus those who had COVID. And we'll have to tease that number out. But at 70%, they'll drop any of these requirements. As you know, the mayor now is very different from the mayor before. And current mayor, I might have lost you there for a second, but I just want to say that this mayor is very focused on opening up safely and is using these analytic thresholds to make it happen. So 70%, I think people will begin to put COVID in their rearview mirror, no matter who they are. Plus, my team is working with a lot of individuals in the business community on what we're calling Safe Events Hawaii, or Hawaii Safe Events, I should say. That's the same kind of approach. Show that you're immune, have the event, but get rid of all of these requirements once the community is safe.
Kuhea has a question. How concerned should we be about the heart inflammation condition that people under 30 have been experiencing, although the case counts are small at this point? It seems that more young people are being discouraged from getting the vaccine because of this. First of all, I just want to address who is getting COVID right now in our community, because so many of our kupuna have been vaccinated, and what are some of the conditions that you are seeing in the people who are catching the disease?
So we're seeing a younger population of people in general catching COVID. And I will say this in answer to both parts of your question: COVID itself is just geometrically more of a threat to our population than the vaccine. You're talking about just a handful of people. Usually it's about 1 in a million people that get vaccinated have some significant side effect or adverse effect. Whereas the numbers of people that have had extreme complications from COVID are super high. 25%, like I mentioned a couple of weeks ago, 25% of all people that end up in the hospital with COVID got blood clots, whereas 1 out of 1,000,000 people who took the Johnson & Johnson shot had a blood clot. So compare 1 in 4 to 1 in 1,000,000. That's the kind of comparisons you end up making when people, and I'm glad they do report scientific challenges and health challenges, but they've been in incredibly low numbers, and that often sends the wrong signal. But we're watching that absolutely every day to make sure that there's not a bigger problem, but also know that hundreds of millions of the vaccine doses have been given with only a handful of challenges. So that's consistent with just people having anaphylactic responses to certain chemicals. It's much higher for most chemicals in this vaccine.
We know right now that the plan really that has been laid out and these benchmarks include, of course, for trans-Pacific travel. But I wanted to ask you about international travel. When do you expect that to resume? And how will that impact the state's protocols that they've set in place? Will international travel still have to abide by the Safe Travels program? What is being worked on to implement international travel back into the state?
Well, international travel is a little bit more precarious concern because of the variants and because a lot of it is unpredictable. We have seen in some of the international communities these stranger variants, and we don't have as much control of our airports. So I think that international travel is going to continue to be assessed but not green lighted for some time, certainly until after we get through the 70% threshold. Also, keep in mind, a lot of the countries that we love to have travelers from, I'm speaking most specifically like about Japan, they themselves have had very long quarantines upon return from the US. And so very few travelers have wanted to come. But look to see these changes after we meet the 70% threshold. I think Japan's waiting also to get past the Olympic Games. I really want to see us solve our problems here within the continental United States. We have actually more travelers than we even dreamt of having. So that's become less of a burning issue. But in the fall, you'll start seeing ease of travel restrictions from international communities.
You know, on that point, on the idea that we have more travelers certainly than we expected, you try to get a rental car, you can't get one. The hotels are charging high rates, especially on, you know, places like Maui, where we just see an explosion of tourism. And not everyone is excited about welcoming this many people this quickly back to our islands. What are your thoughts on the tension that we see between, you know, Kama'aina, who were used to suddenly having all this space for themselves, and then having this influx of people who are coming from very different backgrounds and may not be accustomed to the way you know, we do things here in Hawaii?
Well, it's a tension that existed before COVID, and then we had this very strange 18-month reprieve from significant tourism numbers, but we were also starving. Small businesses were going bankrupt, and people were unable to pay their mortgages or their kids' tuition. So a balance has to be struck. I suspect we'll strike the balance somewhere between 70 and 80% of our baseline, which was 10 million. I think also you're seeing the macroeconomics at play. Economically, prices are going up because there's a very strong demand to come to Hawaii. One of the things I was intent upon was making sure Hawaii was the safest state in the country, have the lowest mortality rate, the lowest case rate, so that people saw we do things better and safer here. People will pay a premium for that. That will mean fewer people, but the same revenue. But we also have to change our economy. I'm not sure we can get into that in our last 4 minutes, but you know, my team is already looking forward for the next 10 years about some of the economic changes and new industries that we should bring here that have almost no human footprint, but bring a lot of revenue. So these will be the changes we'll see. I have had a lot of heartfelt complaints from people saying it's just too many people too fast, but they also appreciate the fact that they or their friends are able to pay for their groceries.
I do, just staying on this topic of tourism, want to just get your overall thoughts on some of the proposed changes that have been made by the legislature to the structure of the HTA, their importance as the legislature has really changed the whole dynamic of the way that it is structured, their funding mechanism. That bill is before the governor right now, as well as changes to the TAT. What are your thoughts on some of these proposed changes by the legislature that may impact travel overall?
I don't personally like to pick a fight with the legislators. A lot of them are my friends, and even the ones that hate me we seem to have found some kind of détente. I will say this: they passed a lot of very good legislation. They helped us get through the crisis. I don't support this potential for a 30% increase in the TAT. I just think that's too much. And I would typically err on the side of not micromanaging that quite so much. I am, however, very grateful for all of the resources that they helped get to the health system and make sure that we kept things safe. We, like I said earlier, kept our cases and our mortality down because we had the resources for that. But there probably should be a couple vetoes just to have things to argue about, and that will come in about a week or two.
Always like to have things to argue about. I know you got to go soon, but there was a couple of questions in here, and Sylvie has one that has been repeated a couple of times here, which is, are you including the people who are getting vaccinated at the military base? When we look at the overall vaccination rate, we did have General Hara on here last week, and he talked about how much the military has been encouraged to get vaccinated, and their rates are actually, it sounds like they're pretty good, but are they included in that 70% that we're striving for?
They are, yes. So we include all the federal programs, including the Department of Defense. And once again, just like people under 12 could contribute to COVID cases, and that's why the decision was made to include them in the overall public health concern. Obviously, our military friends, brothers and sisters that are helping to protect America and Hawaii, they count too. So we're trying to count everybody, and I'll say it like I said it earlier, I will try to be sane about this decision and the advice we give the governor as we get through 60% and then to 65 and 70%. The key is that we are now surviving economically, though it's somewhat of a hassle still to get the pre-test. I get it. Somewhat of a hassle to have some limitations and masks indoors, but we're staying alive and our economy is actually beginning to thrive. So we've done a great job. Let's see this through to the end. Best thing we could all do, if we want to take this argument off the table, is just convince all of our darn friends who might be reluctant to get vaccinated to go get vaccinated, Johnson & Johnson or Pfizer or Moderna. Then we won't even have to talk about this. We can talk about sports or whatever people want to talk about.
As our time wraps up here, I just wanted to ask you, of course, you are on a family vacation, the first one you said you've been on in 2 years. You are experiencing what others are experiencing through this COVID and coming out of this. What have you seen in your travels of what is happening where you're at, how you would relate, or some of the differences that are happening with what you're seeing on the mainland and what's happening here at home?
Well, first, it was wonderful to get away. I'm coming back in 2 days. I will tell you, it turns out that in the COVID era, you have to work on vacation the whole time, but that's okay because there's still ice cream out there after hours. What I'm seeing in these states are that a lot of people are returning to normal. I've seen very few people wearing masks here in the East Coast now. Their vaccination rates in the state that I'm in Massachusetts at this moment, is higher even than Hawaii. And so they've made the decision to kind of back off of most restrictions. But there's still kind of a hesitancy to get back to normal. People are wondering, can they actually be this safe? And I have to reassure my family members even, yes, you're vaccinated, your friends are vaccinated. It's time to hug them and see them for dinner and begin to return to some normalcy. But I can't wait to get home. I missed all of you guys, and I'm looking forward to doing work on regular Hawaii Standard Time rather than this 6-hour difference.
Lieutenant Governor Josh Green, always a pleasure to have you on. Thank you for joining us and working on your vacation. The first in 2 years, we sincerely appreciate it.
No, you guys are great. It's time to get back to normal. So have a great weekend, and I'll see you in a couple of days.
All right. Aloha. Thank you
Aloha.
so much, Lieutenant Governor.
Well, great to talk to him. And, he did lay out this whole question of should kids be included in this denominator when we're trying to reach those 60 and 70% thresholds. Optimistic about getting to 60%, in a week or two, basically, we'll get there. That 70% is a much bigger hill to climb. He was saying, up to 8 weeks for that. Do people have the patience to wait another 2 months to get there? Should kids be part of that equation or not? That is an ongoing debate. And he says if it lags and takes too long, he will be pushing to look at other metrics to try to make the case to open the state.
And we've heard from the governor on this program who also agreed that they're going to take things as it comes, and they will continue to analyze the numbers and look at the different scenarios and situations that present itself, and saying that the 70% is the benchmark, but there may be some flexibility or some room for some changes if they see that there is, of course, safety and that we are, of course, still hitting some of those other benchmarks, including hospitalizations, as the Lieutenant Governor alluded to. But there is the possibility that restrictions could be lifted if we do not reach that 70%. He is also, of course, concerned about that Delta variant, that he said a second case has been confirmed here in Hawaii, and that they will continue to work hard to make sure that those cases are tracked. And again, a further encouragement as to why people should get their vaccination shots.
That's right. He did say that the vaccines protect against that variant. That variant, as far as we understand, can lead to more severe cases and is, faster spreading. So we want to keep it out as much as possible. And the key to that is vaccinations. He said they've opened up many new sites to try to encourage people to have more access across the state. And, again, making the call to, if you have a friend or a family member who is on the fence or needs a ride or maybe just a little nudge, to please do that so we can reach those benchmarks and try to get back to normal.
That's right. Well, we, of course, appreciate Lieutenant Governor for joining this conversation from the road on his vacation on the East Coast. Joining us on Friday, we'll have Ann Poroya-Stockwheel, who will be on the program to talk more, of course, about the things that are happening with the unemployment office and all of those claims that continue to be on hold or continue to sort of be in limbo. We will get an update from her and hear more about what the state is doing to further move those issues along and to help those who are still waiting for those unemployment benefits.
That's right. And 25 governors or more, actually, at this point across the country have eliminated that federal plus up. Those tend to be Republican governors. But she did say that's a conversation she continues to have with Governor Ige. So we're going to ask her about that. Will Hawaii keep the plus up through September as the federal government allows? Or will there be a pullback to try to push people to get back into the workforce? Because on the flip side, we do know that there are a lot of businesses that would like to open up more, but can't because they just don't have the staff.
That's why we're looking forward to that conversation. We thank you so much for joining us. Thank you to the Lieutenant Governor, and we will see you right back here on Friday for another edition of Spotlight Hawaii. Aloha.
Aloha.